Today we have a patient in her mid-40s, and about 4 months ago she was injected by that villainous crew, that mother and daughter team that's been all over the LA news anyway. This patient wants the product out. Again, it was injected about 4 months ago, so it should be pretty isolated in the area that it was injected. So it probably hasn't spread too much. Maybe it's been injected in other areas, but it should be localized where the injection is, and probably not too much scar tissue. So in a patient like this that had previously been injected about 4 months ago, it should be pretty straightforward to get it out with the suction technique. Again, I use the ultrasound to localize it, to find exactly where those pockets are. I use the VASER to break up some of the scar tissue. Shouldn't be too much scar tissue in this patient because, again, it's only been about 4 months and this patient has not had enough time to react and to make a lot of scar tissue in there. When the product's been in there like 5, 10, 15 years, then there's a lot of scar tissue and some spread too. So we're going to use the ultrasound, we're going to use the VASER, and then we're going to use the suction to suck all this residual out. And then we're going to take it to the lab, analyze it, give it to the detective, and add to the prosecution. So let's go to the operating room and I'll show you how we remove silicone that was injected from the buttocks using this ultrasound-guided, VASER-assisted silicone suction technique.
Basically, we're going to set the buttock up so we can do the silicone removal. So number one, we got to pick strategic points to place the incisions. I like it underneath the buttock fold here, where the buttock meets the posterior thigh, infragluteal fold right in there. And we're going to use some prior liposuction sites that she'd had done here before. Going to use it here and here. And then we're going to use the ultrasound to find the silicone. So what you're seeing is those areas that are black, that's the silicone. Areas that are white, deep, gray, that's muscle. So those little white waves in between, that's septa or collagen, connective tissue supporting the fat. But those little black balls in there, you can sort of see them throughout there. Yeah, all up in there, all that is silicone. So we're gonna remove all that silicone. And she's got a moderate amount here. Got some up in there, some down in here. Here's some bigger globules there, closer to the skin. So what we're doing is we're sucking out silicone and scar tissue, and that's why you get sort of this creamy color. Remember the fat that we aspirated, typical liposuction, sort of that yellow orangey? This is sort of like milky, almost like coconut milk. It's sort of a lot whiter. That's because the silicone that was injected about 4 months ago in this case, and some scar tissue. So the first thing I did is I did my ultrasound to find the silicone. I localized it in the center portion, pretty much where it was injected. Second thing I did is I used this VASER cannula to break up some of the scar tissue. She didn't have too much. And then what I did is I used liposuction cannulas, carefully formulated, to remove the silicone and the scar tissue. And again, this stuff was injected about 4 months ago. So it didn't have a lot of time to sort of set up and make scar tissue. So what we got out is here, pretty much the majority of this is all the silicone that was injected and some residual fat. So that's what you see in here. So now we're going to go to the other side and repeat the whole process. product that we removed, and it's pretty creamy. Not the traditional bobas that we get out where the product's been in there for years and years and a lot of scar tissue. So the silicone is mixed up in this, and you can sort of see the shine to the top of the layer. That's all the silicone that I believe is in liquid form. So we're going to send this off to the lab and see exactly what was injected into it. So we're done here with the ultrasound guided VASER assisted silicone suction. And again, the first thing I did was the ultrasound. Second thing I did was the VASER. Third thing I did was the suction. Now we removed that silicone, and hopefully that'll be a lot better for this patient with the removal. She'll be less anxious. It won't spread. It won't migrate. It won't turn into granulomas. Hypercalcemia, renal failure, anxiety, hypertension, all those Asia-related symptoms. So thanks for watching. Please subscribe, and we'll see you next time. So in my opinion, I think the size of her buttock is perfect. I don't think it's too big. I don't think it's too small. And it's very good that she came in early to get it removed. So before it gets to be a problem, in my opinion, get it out. And that's what we did just here. So thanks for watching. Please subscribe. We'll see you next time.